Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
I'm WVUA 23's Ashley Berry, and this is Health Matters. Today, I'm here with Dr. Grier Stewart, who is a clinical associate professor of medicine and associate dean of medical education here at the College of Community Health Sciences. Thank you for being here, Dr. Stewart. We appreciate it.
Thank you.
Today, we're going to be talking about assisted living versus nursing home and kind of that emotional decision that families might go through. So can you start by just talking about what the basic differences are between the two?
Sure. There are a lot of legal and other differences between nursing homes and assisted livings. Nursing homes are also called nursing facilities or skilled nursing facilities, and they perform skills that people might need, that maybe they can't be cared for at home, that sort of thing. Assisted living facilities, on the other hand, have fewer regulations. They, by definition, cannot provide a skill, which may be anything from different higher level cares and or feedings. Maybe they can't do certain activities of daily living, and those folks would not qualify for assisted living, but would qualify for a nursing home.
What are some of the signs that you would look for in a family member when thinking about having to make that decision?
Yeah, it's always hard and it's always very individual, but if a loved one, a family member, isn't able to provide for themselves, they are having accidents, they are not taking their medications properly, just generally not able to care for themselves like they once did, and that care can't otherwise be provided for in the home, that's usually the time that people are looking for long-term care. Now, you can another reason for nursing home care might be what we call short-term or a rehab stay, which is a little bit different situation, where somebody maybe has had a surgery or an illness and just need extra time to recover, and that may be a reason for a short-term nursing home stay.
And what do you think people should look for in a quality facility? Like, are there any details that you would suggest to look for?
Yes. It's a little bit different for each kind of facility. Nursing home is actually, they're monitored by the federal government. There's actually a website called the Nursing Home Compare website, or the 5-star rating system, which can be a starting place, but you know, if something's 5 stars, it's probably pretty good. If something's 1 star, it may not be that good, but there are lots of other variables that go into that. There's no substitute for going and looking at the facility and talking to some of the people and walking around and seeing what it looks and feels like, because this is a deeply personal decision. It is worth talking to the director of nursing and the administrator and see if you can feel what the philosophy is for the individual facility. You know, see what the food looks like. Talk to a resident who lives there. See what the staffing is like, how happy the patients seem, just the general feel, because that's what's going to matter to you and your loved one if you're making that decision.
Absolutely. And what you've seen, what kind of role does the actual patient play in making this decision?
Well, it's going to vary a lot depending on the patient. Sometimes the decision is made to go to a nursing home or an assisted living facility because they can't make those kind of decisions, right? So then it weighs on the family member to take care of that. So if the reason that the individual is going into a facility is more of a physical problem, then they are going to have a big role in making that decision, but the family is always involved.
Mm-hmm. And are these facilities typically covered by insurance?
So that's a complicated question with a somewhat complicated answer. For assisted living facilities, no, it is never covered by insurance. The one exception being an individual has what's called a long-term care insurance policy, that will usually pay something towards assisted living. With nursing home care, those rehab type stays that I mentioned are often covered, or usually covered by insurance. Longer term care may not be covered by any insurance, with the exception of, again, a long-term care insurance policy or Medicaid if the individual qualifies for that.
Nice.
And there are income limits that is based on.
Mm-hmm. I know a lot of families might deal with guilt or uncertainty when dealing with this issue. I know I've seen my family go through it. What's your best piece of advice for a family who's going through this?
It's a hard decision, and no matter how nice an assisted living facility or a nursing home, they're not home, right? It's something different. But sometimes it's a decision that has to be made. It is for the best for the individual going. It is for the best for the family members that have been providing care and will continue to provide care for that individual. I see guilt all the time, and it manifests in different ways, but once an individual is getting to that point, guilt doesn't help. So, it's hard to say don't feel guilty, but don't feel guilty. So just do the best, continue to visit, continue to take care of them. You're just getting extra help from the facility.
And can you give an example of, you talked a little bit about this earlier, but how the care actually differs in assisted living and versus a nursing home?
Okay, when I start getting too technical, tell me and I'll back off.
Okay.
But, nursing homes are very highly regulated by the federal government. They have certain requirements that have to be met, from nursing and staffing ratios to having a director of nursing and a licensed administrator and having a physician medical director as part of the care team. So that's one of the big things, is the staffing ratio. There will always be licensed people, RNs and LPNs, nurses that are going to be caring for the residents there. With an assisted living facility, it can vary widely who the staff is. If it's a memory care unit, what we call a specialty care assisted living facility, they do have to have a physician medical director. They have to have a licensed person that can administer medications. But if it's just a regular assisted living facility, they may or may not have those things. So it's worth asking about it, especially depending on the level of care needed by your family member. It's worth knowing who's going to be providing that care and finding out, okay, I've got 30 residents on this unit. How many people are going to be here to take care of them? So, because it can vary widely.
Well, thank you for being here.
Thank you.